Welcome to the On Your Mind podcast, where we are changing the mental health narrative, bringing hope and solutions. Here's your host, Timothy J. Hayes, psychologist.
Dr. Deborah Simkin, MD, is a board-certified child, adolescent, and adult psychiatrist who practices functional or integrative psychiatry and sports psychiatry. Dr. Simkin is a distinguished fellow with the American Academy of Child and Adolescent Psychiatry and a diplomat of the American Board of Integrative and Holistic Medicine. She is certified in functional medicine by the Institute of Functional Medicine, and she is also board certified in neurofeedback by the Biofeedback International Certification Alliance. Well, Dr. Simkin, welcome. Thank you so much for joining us here today.
Thank you. I appreciate it.
I was hoping you could start us off by telling us how you got into the work you do and what drives your passion for it.
Where would I start? I think I have to go back to when I was growing up. We lived in like a 900 square foot house with 6 kids. My dad only had like an 8th grade education, but he used to have holes in the bottom of his shoes with newspapers, and just to make sure that he could provide for us. And the one thing my father was able to do was to humanly connect with people. You know, when all of us grew up, he went and donated his time to the Lions organization, and this was in Louisiana, and he raised more money than any other Lions organization that I knew of for crippled children and for the Eye Foundation. And he always said, you always get more when you give. So don't expect anything in return. It'll always be there. And he was an incredible man. Now that I look back on my life, I realized he inspired me in many more ways than I thought. But I was not doing really well in school. In fact, in high school, I was told by my counselor to my face, then these words, you're too stupid to go to college. And if you do go, you only should go part-time because you'll never make it. And I believed her. Thank God I had dance. I was a professional ballet dancer for a while. Thank God I had that to give me some sense of identity. But when I was about 27, I realized I had like 5 different learning disorders I wasn't aware of.
Wow.
And I was really happy because that meant I'm not stupid. There's a reason for this. I just didn't know what it was to overcome it. And so it might take me an hour and a half to do something that someone else would take 30 minutes to do, but then I could do it. And so my undergrad grades were only like a 2.49. Grad grades went up to 4.0. Went to med school when I was 32, got the Chancellor's Award, and ended up being one of 3 people at Harvard in child psychiatry. And I just couldn't believe it. My experiences there were so incredible because when I was training as an adult psychiatrist, which, by the way, I fell into, not because of choice. We got pregnant and didn't think we could be pregnant. And so I was going into ENT surgery, and I decided, well, I'll just do something else because I had set up an addiction program for my dean while in med school. But the whole time I was there, I was working with analysts, and I loved to teach. And the entire 4 years, I was told, you're not doing it right. You've got to sit there and just do this. How does that make you feel? And that is not me, Tim.
Right.
And it wasn't until I ran into a child psychiatrist that she said, you need to get the heck out of Dodge. And she said, you need to go to Yale and Harvard. And I literally did this. Who are you talking to? But I went up and all the child residencies were filled at Harvard. And so I was going to do addictions. And what happened was the head of the hospital came in and said, how about we give you a double residency? And again, you know, the same thing, look behind you, wonder what's going on. And it's because I had done so many things in med school to help my dean that he thought using that knowledge with child psychiatry would be a way to go. And I ended up at Harvard. But inspirational to me was, and this is when you asked me about my passion, which is the most important thing for all of us to be. It's being a good mentor. And while I was there, Dr. Nesty, who I just adored. Every time I went into his office, I would apologize first and say, I know I did this wrong, but I taught and this is what I did. And so the second time I came in, he sort of stood there and listened. And the third time he met me at the door and he said, Deb, the next time you come in and apologize for a gift in child psychiatry, don't come back. And I paused and I looked at him. I said, what do you mean? He said, don't you understand? Being a good mentor means you have to feel confident in yourself and feel comfortable with who you are so you can find the gifts in the people you're mentoring. But he said, in my opinion, the people you were training with before, they felt so inadequate with what you did well that they projected it onto you. And my answer to that was, I love you, Dr. Onesti.
Yeah.
But, after that, one of my mentors was Charlie Popper, who was the former head of the Journal of Child and Adolescent Psychopharmacology. And I walked out of my residency and headed up the addiction committee for the Academy of Child and Adolescent Psychiatry. But Charlie was really starting to change his tune. He was really starting to look at why are we where we are when we treat patients, what got them there. And he started looking at nutrition and broad spectrum micronutrients. And, he and several other people, Wayne Batzer and Scott Shannon at the Academy, got permissions to start the Committee for Complementary Integrative Medicine. And they asked me to come on board. And it was at that moment that I realized what I was missing. I was missing that human connection that, because everything at Harvard initially was a lot of psychopharm and medication. And I thought, this doesn't feel comfortable.
So how long ago did they ask you to come on board for that?
Let's see. I was the head of the addiction committee from 91 till 2000. And then they started the Complementary Integrative Medicine Committee and then asked me to move in with them. I think they started it, though, around 2010. I'm not sure. But either way, I made this transition and I was still doing a lot with addictions and I was teaching. And then Scott was a member of the American Board of Integrative Holistic Medicine and convinced me to go and take the board. And I did. But it was very, very, it was a lot of things I'd never come in contact with. And it was a lot of names of plants I couldn't even understand. I literally thought I'd failed the exam because they used all the generic names and I had memorized the sort of brand names, if you will. But I passed. And then a remarkable thing happened. I decided to go back to Harvard to train with the PhD psychologist, who, by the way, is also a Buddhist monk, who trains a lot of our Olympic athletes. And of course, he uses a lot of meditation. And while I was there, I really got inspired about this whole idea that, you have to be in a good state of mind in order to do your best work. You have to be able to feel at peace with yourself and find your own spiritual self to be at your best. And that's basically the philosophy he would teach to the Olympic athletes. Your body may be great, but if your mind's not in the right state of mind, what you do when you compete will not come forward. And while I was there doing that, I called my son, and he was at the Air Force Academy, and his major was international studies with a minor in Japanese. And I was telling him about this, and he said, well, Mom, the Air Force has been sending me to Japan for the last 2 years to train with the Buddhist monks. What?
Wow.
I was shocked. And his last year at the academy, he was jumping out of planes. And of course, we bought him a parachute because we didn't want him to die. But unbeknownst to us, the Air Force told me he couldn't jump out of planes anymore. He's going to be a pilot. And he sold his parachute, and he came home without any warning after graduation and said, I have 3 tickets to Japan. And he took us to Koyasan. Koyasan has a lot of Buddhist temples, and we went to a ryokan where you put on the robes and the slippers, right? And he said, when the gong goes off tomorrow, I've been down several times. You and Dad go down and just experience it. So we did. And I thought I was going to see them start by breathing, right? Because I was taught, focus on your breathing, not so much to relax, but if a thought pops in your head or you hear a noise, focus immediately back on breathing, because you're training your mind not to get distracted so you can get benefit from this meditation. So instead of that, seeing them breathe, they were actually chanting. And I realized, oh, so that's what they're using for their attention focus. But when it was over, I asked if I could ask a question, and the chief monk came out. And I said, look, I'm not a very smart American. All I see is these statues in the United States with big bellies, and they call them Buddhas. And he started to laugh because obviously, none of them are overweight. And I said, what is a Buddha? And to my surprise, he said, well, do you know who Mother Teresa is? Well, yeah, but what does that have to do with what we're talking about? He said, no, tell me what you know. And I said, well, she was a nun in India, and she was always working in dangerous areas. Her life was always being threatened. He said, yeah, that's the one. I said, well, what do you mean? He said, she had learned to use, either through prayer or meditation, the ability to get in the best state of mind so that she could emotionally connect with her patients and do her best work. And in that state of mind, she would not be distracted by her surroundings. And so I said, so you're saying anybody can be a good Buddha? And he went, yes. And then my husband, who normally always embarrasses me, wanted to ask a question. And I thought, oh, wait for it. We're going to have something funny said, right? And he folded his arms and he looked at the monk and he said, do you ever take a vacation? And his answer was, why would I have to? I'm always on vacation here. Blew my mind. So I came back and I thought, I've heard about functional medicine. I just felt like we weren't doing it all. We weren't looking at all the systems in the body. We weren't really, if one system goes awry, how does another system get affected? We were just sort of thinking, okay, so omega-3 fatty acids are very good, and there's good research to back it up in terms of, preventing depression, but we're doing a same thing I was taught initially, a one intervention for one disorder, rather than looking at everything that goes on in the body and trying to make every system that's been influenced by this, the problem that started in the beginning, that made everything go awry. And I knew I needed to be more comprehensive. And there wasn't really anybody in child psychiatry doing that. So I went to the IFM week-long introduction and my mind was blown away, because everything we do,
and IFM. So IFM, for our listeners, Integrative Functional Medicine?
Yes, sorry, Institute of Functional Medicine. And, I saw a whole array of people, naturopaths, MDs, DOs, chiropractors. But the one thing that you and I have been trained to do, which is getting a good, timeline, a good history, was natural for me. And they were going back to that. And they were trying to find out all of the antecedents. What's the genetics? What's the triggers? What's the mediators that continue to this going on in that line? Finding out where it happened in their life and explaining that to the patient, which I love because then I could use my education. And then trying to look at lifestyle to do one thing. And that was to get the person in the best spiritual, mental, and emotional state. We were back to what medicine was meant to be. And we lost it when the Flexner Report happened at the turn of the century, because that closed 75% of the medical schools. They wanted all the medical schools to be, teaching the same thing. And they wanted to up the ante and make it mostly about science. But we lost that human connection. In fact, William Osler, who was at Hopkins at the time when they were doing this, said, I'm worried that we're going to lose the ability to see other entities out there as meaningful, and we won't put emphasis on that. But more importantly, I'm really worried about losing what's important here, and that is your relationship with the patient and the people you teach. And it wasn't until, like the 1930s when Jacobson started doing, what was it? It was a relaxation technique. I'm forgetting it. And then in the 70s, you started with the American Board of Holistic Medicine, and they joined with the American Board of Integrative Holistic Medicine, which became the Academy of Integrative and Complementary, American Board of Integrative Medicine, which is the certification I had. And so, I got boarded in both, but I feel like IFM, Institute of Functional Medicine, really is going back to using and looking at everything in your life and normalizing it and trying to realize that if we're out of control, it may be because we're just not educated about what we need to do all along. If we were taught what the monks were taught and they teach to other kids early in our lives, maybe we wouldn't have so many of the stressors that cause inflammation in the brain and lead to us overeating and eating the wrong things and putting toxins in our body that we don't have knowledge about. I keep going back to what I didn't know about me. And I kind of feel like the American society doesn't have that knowledge either. And it's really important, I think, at this point for all of us to continue to educate and to teach people that just because what they're fed on a commercial, about the Whopper burger isn't necessarily good food.
Right.
And how do you deal with your life? How do you look at everything in your life and try to catch it early so that it doesn't lead to multiple systems being affected? And that's why I think child psychiatry is so much fun. I can do it earlier.
Right.
Right. And, and then educate families about what's going on. And it really goes all back to my dad, the human connection. It goes back to how do you overcome something if you don't know what it is? And giving people that knowledge, because I think knowledge is power. And I guess that's where my passion is now, continuing to teach. I teach at Emory Medical School, and I teach, functional psychiatry there. But every person I meet, it's sort of like, how do we connect? How do we help each other? It's not just me as the doctor and you as the patient, but what do we do together to solve your life and give you the information so then you can make a decision?
Well, and it strikes me that, one of the things I heard you talk about, one of the last times I heard you give a presentation, you talked a lot about inflammation, their growing body of knowledge about how so many of these psychological and psychiatric issues really do have their roots in inflammation. And you were talking about various things like EFT tapping and exercise and some others that now they've got some scientific research that says these really help reduce inflammation.
Right.
Can you talk about some of the key things around that, the issue of inflammation in the body and the brain and what you found to help with it?
Well, I think, first of all, when the Flexner report occurred, unfortunately, none of the research that could have continued with what we do today in terms of integrative medicine or functional medicine stopped. And, when the supplements were taken out of the FDA, the funding for any kind of research like that from pharmaceutical companies just went away. But, I think that we've got to keep doing the double-blind placebo-controlled studies. And I know I'm kind of going around the loop here to get to the answer to your question. But
that's
basically,
fine.
What our committee has dedicated themselves to is, in fact, we're doing it right now, is producing a clinical update that is using all of the research that is out there that shows it has credibility, and then coming up with recommendations for the American Academy of Child and Adolescent Psychiatry and what really is useful. But in order to do that, you really have to look at, as you said, inflammation, because I can't think of any area in whether it's autoimmune diseases or psychiatric problems or whatever that isn't influenced by inflammation. And there's so many components of that. So from, the food you eat that is sprayed with Roundup, which is a weed killer, it's glyphosate, that kills all the normal microbes in your gut, and most of us started eating cereal when we were 6 months old.
Oh, yeah.
So from an early age, that microbiome has been changed. And that microbiome then, because the GI or the gut itself is so immature and so fragile, then you can easily get food sensitivities you may have never understood, not an allergy, a food sensitivity. But then you look at all of the things that happen throughout someone's life, whatever is, whether it be abuse or whether it be, weight gain, because now I'm coping with my stress by overeating, again, increasing inflammation, increasing insulin resistance, and, more toxins being put into our bodies that is unheard of. All of those cause a breakdown of the gut. And I think the gut, although it was laughed at 20 years ago, dysbiosis and leaky gut, it really is a resource of where all this inflammation begins. And, if you go to the brain and you have all this inflammation, you cannot produce the normal neurotransmitters because the inflammatory response prevents that. You cause the hypothalamus and the pituitary and the adrenal gland, which for your audience is really what goes up when you're in fight and flight, right? Well, it stays upregulated. It never normalizes. And in that state, pain is 10 times worse. Stress that you feels 10 times worse than it really was. The other thing that happens in the brain is that you have microglia, which are just white blood cells. And their normal task is to go around and clean up all the debris and toxins in your brain. Well, when you have inflammation, they change their priorities and they start producing inflammatory cytokines or more inflammation in the brain and attacking your own neurons and causing changes in neuroplasticity. Beyond that, you can't absorb the things that you need for the brain, like, B12 or folate, and that's needed to produce neurotransmitters as well. And then, of course, you have all the problems with, like, for instance, toxins. This is one of the things we're going to be putting a lot of emphasis on this year. If you are continually eating food that has glyphosate in it, because all the wheat in this country is sprayed with it, the bacteria that can sustain that, because it works as an antibiotic to kill off the normal microbes in your gut, is Clostridium. And they have been able to identify organic acids in the urine that are produced by Clostridium, which in fact can make dopamine in your frontal lobes toxic. And then there was a wonderful case where this woman, they thought she was schizophrenic and she was in an acute psychotic state. And they saw a particular organic acid that was being produced, which meant that the dopamine wasn't breaking down and it was getting toxic in the brain. When they treated the Clostridium to get rid of it, lo and behold, her psychosis went away.
Wow.
So there's, I'm 71, but I wished I were 20 because there's so much out there that we need to get to people in terms of their knowledge. And there is a wonderful site. I hope I can say this for your audience, but it's called Ewg Healthy Living. It's an environmental working group. And it was a bunch of scientists who got tired of the toxins in the environment and said, we can't control what the government puts out there, but we can control what we allow ourselves to be exposed to. And they formed this free app for your phone where you can just put in any product that you use, household shampoo, deodorants, whatever, and up will pop up all the toxins in it. So that when you go to buy another product, rather than buy the same thing, you can then just put in detergent and up will pop up 20 or more things with no toxins. And you can simply go and online and see the reports from different people or customers who've bought this and then decide for yourself what you want to buy.
And that's just ewg.org.
Ewg Healthy Living.
Yeah, but I'm pretty sure I got to it just, ewg.org. And
it's not the only site. There's something called I can't remember, Dirty Something, but there's several sites like this, but I like this one the most.
And then they have an app, as
pardon?
you mentioned. And you mentioned they have an app just to make it easy.
Right. You know, I think we've got to, in the American society, understand too how much we've been brainwashed. I mean, the first Burger King that was built in my hometown outside of New Orleans. And I remember going there and eating 3 Whoppers, 2 orders of fries, and a malt. And to this day, when a Whopper comes on the screen in a commercial, I start salivating. You know, the marketing is smart. And, you know, it's very hard to change the way you eat, because literally the bacteria that are in your gut love to live off these processed foods, right? So they control your eating. They give off a hormone called ghrelin, and that then tells you to really crave these junk foods. So it's very hard to change. People think, oh, it's just me, I can't do it. No, it's the bacteria in your gut that's controlling what you're craving. You know, and once you can get them to go away and stop beating them, that craving goes away. So changing the mindset, I think, is one of the hardest things I think I come across. And I'm sure that's for you as well, because people are used to living the way they live.
Well, and they don't realize that what they think and believe was programmed in, right? They think they're thinking it. Because it's been in their mind for so long, they don't realize that it's a trained response to the constant input in the eyes and ears, and that can be changed. But it takes that conscious decision to put better stuff in, to start questioning. And, you know, some people, I've worked with a number of doctors that say, you know, that breaking that sugar craving, that craving for all that junk food, is one of the hardest things you can do. Some people need a reset, like a fast for a few days, and then slowly coming back off the fast in these only whole foods, real foods, that, you know, grew in the ground or grew on a tree. Yeah. And when they do that, and some people need supplement for the gut biome, as you're talking about.
Oh, absolutely.
But when they do that, they don't have the cravings.
Right. And, you know, what people also don't understand, and there's a wonderful, you can't say it's causation, but as the use of glyphosate went up in this country, the rate in which autism increased correlated. And that's because autism has a lot to do with mitochondrial diseases. And some of these things we're eating, or some of the toxins we're coming in contact with, actually prevent the Krebs cycle from working in mitochondria, right? And you can pick that up too, but you can also identify, well, is it, you know, mold that's doing this? Is this the non-metal toxins we're coming in touch with? Is it heavy metals? But, you know, changing the course of that, and early identification, early information about people before they get pregnant, I think, is even more important. And, you know, in changing mindset, I always tell this story because I was so inspired by it, but you can do that if you want to. The thing is, you've got to see that perhaps what may happen in changing your mindset may be worth or full of many rewards. My dad grew up in a very, very prejudiced part of New Orleans. And so he was taught to hate Blacks. Now, one-on-one, he was never like that. But as a group, the only thing I feared about him was when you could see that come out. However, I went to one of the crippled children camps one time, and I saw my dad kneeling down next to a little African-American girl who was paralyzed and in a wheelchair. And I saw him holding her, and I saw her crying and him crying. When he walked back, I said, "Dad, what's going on?" He said, "I'm so angry." I said, "Why?" He said, "Because I bought into this all my life. And if I had not let that go, I would not have seen the beauty of that little girl's soul." Sometimes you have to tell stories to help patients. And I do use a lot of stories and analogies, because once you do that, if you can humanly connect with the person you're working with, then maybe they will see virtue in them taking a look at this and changing their life too. And maybe everything, as you said, that we've been brainwashed to believe isn't really true. So, but you got to be able to just tell the stories, I think, that connect people. And that would not be taught to me by analysts.
Right.
Share my story.
Right.
The one thing that I did love also about Dr. Onesti when I was at Harvard was he was a child analyst, but he said, you cannot do that with children and adolescents or even adults. You have to tell your own personal story. And if you don't, you won't be able to connect with them. And he's very right. That is so true. So I think all of those things have led me to where I am today. Hopefully, not just me, but everyone who's in this field will continue to be able to get the message out and help people. And hopefully by sometimes sharing our own stories, we can inspire just as we've been inspired by those who got us where we were or where we are.
Well, and that, when you're in that sharing space, when you connect with people, truly connect with them, that's when the work moves from, I think 80 or 90% of the risk of burnout drops away if you connect with the people you're dealing with. If you're viewing them as though you're the expert and they're the patient and you've got all the answers, burnout is right around the corner.
Absolutely.
But when you connect with people and understand you can learn as much from your interaction with these people as they are going to learn from you, and they enrich your life in ways that you can't get if you don't stay open to it.
Right.
Then you open a world of growth for yourself and the people you're working with. But it has to happen through that connection that you're talking about.
Right. I love what you're saying, because that word enrich, wow, it does enrich us. And it's what we'll look back on and say, did a good job. Really helped somebody. Otherwise, you can't help them, like you said.
Well, and here's a story you said about stories. There's a gentleman who wrote a book. His name may come to me, but the title of the book was "I'm on Fire, Watch Me Burn," and it's about having a passion for what you're going to be doing your public speaking for. And in that book, he talks about how he got to a certain level in his public speaking where he thought he was really good. And they asked him to come and judge a speaking contest. And he sat there and he just said, oh my God, this is horrible. And oh my God, these people, how do they think they're the public speakers? And he doesn't know why, but they invited him back to do it a second year. And in the interim, he had a mentor who said, come down off your high horse and learn from every interaction you have. So when he went back the second year, he took blank sheet of paper, and at the top of each one for each speaker, he wrote what I can learn. And at the end of that, he said, oh my God, these speakers were so much better this year.
Love it.
Because he learned a lot.
Right.
Just by changing his frame.
You also have to be really strong in your own identity, because there's a lot of people out there who will tell you, because of the old methods of doing this, that, you should never share your personal life, and, you're wearing your heart on your sleeve. And I'm going, yes, I am, but I think
and there's a balance to be had too, because, there are some people who are so wounded that, when you end up in a therapy session with them, they're having the therapy session and you're paying them, right? And they're telling you about all their problems, and that's not good. But what you're talking about is this balanced approach where you understand you're a human being and they're a human being, and the connection that's needed for all of that therapeutic stuff to unfold is first order.
Right. I mean, I now know, because of what Dr. Onesti said to me about the analysts I work with, that anybody I come up across who says, it makes people uncomfortable because you wear your heart on your sleeve. I often think, well, that's probably because they're feeling inadequate about their inability to do it. And they're again projecting it on you, And there's, yes, you shouldn't share all the time. There's certain patients you need to take your time with, and you need to know that wouldn't be the right time. And that's the skill in doing what we do. The bottom line is, if you're going to connect, you have to be able to do that.
Well, and it reminds me of dealing with parents who have somehow gotten this faulty notion that they shouldn't let their children see them have any of the weaker emotions, the sadness or the hurt or the confusion.
Right.
And it's completely counterproductive. I mean, if the child can't watch the parent go through those emotions, how can the child think he or she is normal when they have similar emotions? And or how can they learn to manage them within themselves?
Right. And I think what you have to teach parents there is, when you're there, don't let yourself see yourself as helpless. Be emotionally vulnerable. But if you start to feel helpless, then they're going to feel that having that emotion means they're helpless too. And the bottom line is that, and I always use this, I love the junk thought technique, and that is, if you're feeling anxious and you're feeling you can't handle it, it's probably your own unconscious junk thoughts telling you can't, right? And so recognize that and take a breath and realize you're okay, but don't allow yourself to put the walls up, allow them to see those precious moments and explain to them that it doesn't destroy you. It empowers you, because once you're through that, you can handle even more.
Right. Right. One of the bottom line observations I have that I give to patients in a first or second meeting says, if I have a negative thought about myself or somebody else, or a negative emotion that's up in my system, I can instantly know three things. The first one is it's a lie or based in a falsehood. The second one is it's not about the current situation. This is an old tape playing. And the third thing is, if I take an action from it, even if I just sit and think from that, or I say something or do something based on that negative emotion, I'm just going to make my situation worse. I can't improve my life by throwing negative energy into it.
Right. I mean, so beautiful. And, that is exactly the method they're using with the Olympic athletes, right? Who's more perfectionistic than them? So you don't want to get rid of being a hard worker and being diligent, but you also have to recognize you're harder on yourself. And when you get up to go, if for one moment you start to feel anxious, then it's your own junk thought saying, you can't handle this, you can't do this, stop. Step back, get angry at the junk thought. And then I think this is what was so meaningful. If you've practiced meditation long enough, and I do this several times a day in my office when I'm feeling like, okay, I'm getting a little drained here, step back and be able to visualize a moment when everything went well. Use all your senses involved in that moment. Practice it though, because you got to find the one sense that brings back that feeling and that state of mind that makes you feel almost spiritual, right? That makes you feel content. And if you can bring that up and go to that moment, then what follows is you at your best, which is exactly what you alluded to just now, Tim. I mean, if you stay in the state of mind where you're anxious because of this junk thought, then what follows is never you at your best. Right. And it's such a beautiful philosophy, and it's just incredible. And it's easy to teach people.
And didn't you have a story related to that with Shaun White?
Yeah, well, Shaun White, this guy trained Apollo Uno. He trained, I think it was Shaun White, but basically, and I can't remember it was him or someone else, but basically there was this, Shaun White in his last Olympics, not this last one, he went back, but probably shouldn't have, but he went and there were 3 runs, and you see the second run, he fell and the other 2 guys didn't. The third run, the other 2 guys went first and they fell. And this was his last run of his Olympics. And you see him get up to go. And what I was told was that you see him pull back and he's pulling on his mask and he's fixing his goggles. And what I was told was he recognized he was feeling anxious and that was not the moment to go. Now, whether this was true or not, but this is what I was told. And so he stepped back and he got angry at the junk thought and he was visualizing his last Olympics. And he was using all his senses involved, his last hitting on the ground. He saw the snow come up. He heard the swoosh. He heard people saying, USA, USA. And then he thought he had it. And he went up to go again. And you see him pull back again. And what I was told was that if you don't find a sensation that brings back that awesome feeling strong enough, then the junk thought's going to override it again. So he stepped back. He got angry at the thought. But what I was told was that he imagined again, visualized again, the end of his last Olympics when he got the gold, and he was scanning the crowd and suddenly saw his dad doing this. And that did it. And he just went. And when I think of that story, it's awesome because I had watched that run, and that's one of the most spectacular runs of his life, So, I think it's a perfect example of how we have to look at our own lives. We've got to be able to recognize, like I said several times during the day, because I'm pretty obsessive compulsive, I'm hard on myself, and I know and I recognize it. I may feel helpless or I may feel a little anxious, and I know, okay, there you go again. And if you stay in that state of mind, then whatever you do, like Mother Teresa, you will not be able to be in the best state of mind to emotionally connect. So I step back, I close the door, I recognize the junk thought, and I think of those moments, either when I danced or more importantly, when I've been with a patient and I've made a difference in how spiritual that moment was, not just for me, but for the patient. And then I'm in a different state of mind. And then what follows is me at my best, hopefully, but better than I would have been if I was anxious or
exactly.
So it's so simple to teach people, but, and again, I think if you can get them to take the time in their day to, really sit down and just, meditation doesn't have to be some spirit, crazy kind. A lot of people see it as kind of strange and, associated with Buddhism. I'm not too sure I want to do that, but really it can be listening to music.
Well, and it's, some people are more comfortable with a term like focus or mindfulness and or practice rather than meditation or the Buddhism. It's a training that is kind of that counterbalance for the conditioning I've had for so many years, which was an automatic process, and this is a conscious awareness process. So I can kind of compensate for all the years of conditioning when I was being basically told what to do without realizing it.
Right. And feeling guilty if you didn't do it right. I don't know if your viewers have seen the series Ted Lasso, but talk about human connection. It's phenomenal. It's written as a trilogy, and Jason Sudeikis from Saturday Night Live wrote it. I didn't even know who he was until I saw this, but it's on Apple TV. And my son actually got us to sit down and watch it. And it's about this football coach in the United States who he and his wife are getting divorced. So to give her some space and separation, he goes to England to coach a professional soccer team, and he knows nothing about soccer. And it's hilarious because you find out why he uses humor so much. As the story goes on, you find out more about him. But the one goal, or the one thing he does so beautifully, is his ability to emotionally connect with his players. And in the second season, a sports psychologist comes in, and you learn so much. And it's just inspiring. All the actors in this have said they'd go home after doing this series and they're kinder because of it. Wonderful. So it is something to watch. It does have a lot of cursing, we'll warn you, because it's football players, but it's only going to be written as a trilogy because he wants to make a point. And it sort of brings us back to what we used to be. And with all the media and all the, technology we have today that keeps us in this constant state of mind, if we continue to look at it, we have a hard time finding who we are. And I think that I actually use it for therapeutic interventions with patients sometimes to talk about things, but it's beautifully done. And it does really talk about the human connection. And so I would advise people to watch it.
All right. Well, I realize that we're completely out of time. I can't thank you enough for doing this interview. And I'd love to be able to bend your ear again and pick your brain a little about a specific topic of your choosing related to what's most effective when you're trying to assess somebody that comes to you as a child or an adolescent, or the parents that bring them. But I grateful beyond words. Thank you so much for joining us, and I look forward to our next time to connect.
Thank you, and I'm so grateful to you, Tim, and thank you for all you do, and so wonderful to connect and emotionally connect with you as well as a colleague.
I appreciate it. Thank you.
Take care.
Dr. Deborah Simkin, MD, is a board-certified child, adolescent, and adult psychiatrist who practices functional or integrative psychiatry and sports psychiatry. Dr. Simkin is a distinguished fellow with the American Academy of Child and Adolescent Psychiatry and a diplomat of the American Board of Integrative and Holistic Medicine. She is certified in functional medicine by the Institute of Functional Medicine, and she is also board certified in neurofeedback by the Biofeedback International Certification Alliance. She is the co-chair of the American Academy of Child and Adolescent Psychiatry, the Committee on Integrative Medicine. Dr. Simkin trained at Harvard's McLean and Mass General Hospitals in child and adolescent psychiatry. Following her residency, she served as chair and co-chair of the American Academy of Child and Adolescent Psychiatry's Committee on Substance Abuse. In that position, she set up a liaison between the AACAP and the National Institute of Drug Abuse at the National Institute of Health. This was done to increase research among child and adolescent psychiatrists. She also set up a liaison between the National Center for Complementary Alternative Medicine, soon to be renamed the National Center for Complementary and Integrative Medicine, at the National Institutes of Health, to increase interest in research. Dr. Simkin has served as associate professor at Dartmouth Medical School, clinical assistant professor while teaching residents at LSU School of Medicine, Department of Psychiatry, adjunct associate professor while at the University of South Alabama, and is presently adjunct associate professor in the Department of Psychiatry at the University of Emory Medical School.
You've been listening to the On Your Mind podcast, offered by Journey's Dream, where we support people through mental health challenges to a place of true and lasting well-being. If you love our show, we invite you to visit onyourmindpodcast.org to join the conversation, access the show notes, and discover our helpful resources. Thank you for listening.